Let me introduce myself. My name is Alena Leonova. I am an associate professor of the psychiatry department of the Tyumen State Medical University, which is located in Tyumen region, Russian Federation. The field of my professional interest is child psychiatry. That's why my report today will touch psychiatric health of infants and early age children. Developmental language delay refers to speech disorders, which is the acquisition of speech later than normally. In the population, developmental language delay is in 6 to 7% of cases. The frequency of occurrence among boys exceeds 2-3 times more than among girls. Experts all over the world have determined that the first word should appear by the age of 12 months. However, if this didn't happen by the age of 24 months, then this is developmental language delay. By the age of 3 years, the child's speech has developed so well that the child can easily explain himself, tell about his desires and difficulties. But if he uses only separate unrelated words at the age of 3, then this is developmental language delay. It was found out that developmental language delay is almost never the only violation of a child. There are concomitant problems and difficulties that may relate to different aspects of the child's life. The great importance is given to the emotional and behavioral impairments of toddlers with developmental language delay. An important aspect is the relationship of these two components. First, this is the close location of language and behavioral centers in the brain. Secondly, language skills provide socialization of the individual. Failures have a negative influence on emotional sphere and behavior. The present trial is a 1-year follow-up study of a child psychiatric outpatient sample. The study includes children from the age of 1.5 till 3 years who underwent periodic medical examinations or sought help from the Center of Speech Pathology. At the first stage, 230 children were examined randomly using the clinical and psychopathological methods. According to the results of the survey, a division was made into the main group, 100 children, and the control group, 50 children, comparable in age, sex, and socio-demographic status. At the second stage of the trial, the study of the mental and motor characteristic of child from the main group was carried out. The third stage deals with the study of the clinical structure of emotional and behavioral impairments. The main research methods are clinical and psychological. Psychiatric examination of toddlers has a number of features. The presence of family members or guardians together with the child represents the main source of information and reduces the child's alertness towards strangers. The most important part of the examination is the child's game. After interpretation, the received information is recorded in the form of a traditional mental status. The clinical study is supplements with data from language development survey. The method helps to identify problems in the child's language development using a question form filled in by the parent. The Bailey scales of infant and toddler development is a highly valid method for assessing the neuropsychiatric, motor development, and behavioral characteristic of a child. Child behavioral checklist is a tool that allows specialists to solve the problem of determining behavioral and emotional children's disorders experimentally. All children have been examined by a pediatrician, neurologist, and speech therapist. Every child gets an encephalography and echoencephalography. In 84% of the examined children, early psychomotor development corresponds to the norm. 16% of children began to sit and walk a little later. Mothers of 6% of children indicate reduced vocalization activity between the age of 6 months and 24 months. All the children at the first stage of the research have been examined using the language development survey. The first part of the survey consists of 310 words divided into groups, and the second part consists of finding out the length of spoken sentences. As a result, the differences between the main and control group in all indicators are statistically significant. Then the children from the main group are examined according to the Bailey scales. Not a single child receives the results corresponding to the impaired development in all three assessed criteria. However, some of the surveyed children receive lower scores on one of the scales. The index of mental development calculated according to the survey data corresponds to the limits of the norm in 88%. The remaining 12% receive the result transient pathology. The psychomotor development index within the normal range is calculated in 96% of the examined children. Children have had difficulties in tasks with small objects. Besides, tasks in general motor skills cause difficulties in 16% of the examined children. On the behavioral scale, 92% of children had developmental language delay receive scores corresponding to the normal development, despite of 76% of children had a slightly lower result of various groups of questions. The mental status of the majority of children in the main group reveals both behavioral and emotional impairments. The main symptom is the instability of the emotions. Then comes an increased psychomotor excitability. Restlessness, uncontrolled motor activity is detected in 34% of children. Various fears have been found in 29% of children. The level of detected impairments, its mosaic character, doesn't allow them to qualify and start therapeutic measures on time. All these reasons support the need for a more differentiated survey. It is worth noting that in all parameters of CBCL, the differences between the children without developmental language delay and children with this disorder is statistically significant. At the same time, both groups identified children without emotional and behavioral impairments, as well as those examined who has severe problems in the areas under consideration. The boys were characterized more with external problems, including attention problems and aggressive behavior. For girls were characterized more with internal problems, consisting of emotional reactivity, anxiety, and somatic disorders. Based on the cluster analysis of the clinical examination data and the CBCL, 3 types of emotional and behavioral impairments have been identified in toddlers with developmental language delay: emotionally labile, emotionally detached, and oppositional. The emotionally labile type includes such basic characteristics as mood irritability, sleep problems, and attention impairments. Affective outbursts accompanied by crying and angry mood continue for a long time and don't pass without external intervention. Their severity and persistence concerning all or most of the situation in which they manifest allow us attributing them to disorder of emotions and behavior. The emotionally detached type is manifested by isolation, anxiety, and somatic problems. Children with an emotionally detached type are characterized by a strong preference for peace and quiet, and a lack of desire to get involved in games. This behavior is not associated with the periods of illness. Stressful situations exacerbate the symptoms of somatic diseases. The oppositional type mostly includes evaluation related to destructive, impulsive behavior and aggression, both directed at others and self-directed. The regularity and uniformity of the manifestation allow us to distinguish them from the phenomenon of the crisis period. Despite of the fact that toddlers with developmental language delay have a normal motor development in 84%, in future they may have difficulties associated with increased clumsiness and low differentiations of finger movements. The data obtained in the CBCL correspond to the data obtained by other survey methods, but provide expanded information. The presence of subclinical symptoms needs preventive measures. Timely implementation of the individualized preventive and therapeutic measures selected in accordance with the type of mental impairment will help not only to adapt children with developmental language delay in society, but also to improve the quality of life of the patient and his/her close people and future. Thank you for your attention.